We have to correct why did this stuff happen in the first place? And surgery is not going to address that. It's only going to address the structure. So if you are under this illusion that I'm going to have this, it's going to fix the structure, I'm going to come out on the other side, I'm not going to have any pain anymore, I'm here to tell you that is probably not going to be the situation. Hey guys, what's up? Dr. Jenna here, and welcome back to the Unchoreographed podcast. Today, I'm super excited to continue the conversation on surgery and labral tear surgeries. If you joined me last week, we talked a little bit about some of the reasons that I see people quote unquote fail surgery, meaning they have the surgery and still end up in a ton of pain. And I kind of want to keep that discussion going this week and talk about what types of things you should be thinking through when you're trying to make the decision on should you have surgery or not. And the reason that I am recording this one is honestly because I have had this conversation with, no joke, probably 5 different people just this week alone. I would say this is one of the biggest reasons that people seek me out for consulting. They're curious to get my take on their situation and if I generally recommend surgery for something like this. And I am obviously not a surgeon, but I do specialize in helping people manage this conservatively. So I do have some thoughts on it, and I want to share them with you and kind of walk you through the same decision-making process that I do when I work with a client one-on-one, so that you can start to sort of see what things you should be thinking about and considering when you're trying to decide if you should have surgery for this or not. I honestly just think that so much of it is learning how to manage your expectations around it. And I think people jump into surgery being the only option sometimes too soon, and they haven't really considered a lot of these things. So to make it abundantly clear, I am not anti-surgery. I absolutely think that there is a time and a place for labral tear surgery. And I definitely have had many cases where clients, that is the outcome. Sometimes I have clients that they're not sure if that's going to be the outcome, and they start working with me to see what happens. Sometimes I have clients that they know that that's going to be the outcome, but they're kind of taking a proactive approach at it and trying to make sure that that they're going to handle it well and recover well. And then I have a lot of clients that come to me after they have had surgery and things haven't gone as planned. So I definitely have a lot of thoughts on this entire thing, and I'm excited to share them with you guys. So while I'm not anti-surgery, I definitely, like I said, I think there's a time and a place for it. I think what really it's more about is that I'm pro making a decision that you're not rushing into, making sure that you're understanding what really matters and paying attention to some kind of key indicators of if surgery is really what you need or not. And I think just making sure you're not rushing into things is the most important thing. So that's what I try to bring to the table for each of my clients and help them walk through that process. So what I did is I broke it down into 5 decision-making points. So these are the things that I talk about with my clients and the things that I want you guys to think about as you're listening to this episode. You can kind of determine where you fall in each of these categories. And then at the end, I put together a free resource for you guys so you can download it there as well if you want to just have it all in writing and reference it back later without having to listen to the whole episode. So 2 different options for you guys there. But okay, let's dive right into the decision-making point. So should you have surgery, or should I have surgery? Should I wait? What should I do? So the first and most important thing that I want you to consider is, what is the impact on your day-to-day life? I think without a doubt, this is the biggest predictor of someone who has surgery or not. How much is it impacting you? You know, if you rated it on a scale of 0 to 10, 10 being you can't get out of bed and do anything, if you're at an 8, 90% of the time, that's a really different situation than if you're hanging down around a 1 or a 2 and it's just annoying, but it's not actually creating a whole lot of limitation in your life. So a lot of times you're going to get the MRI and it's going to say, oh, you have a labral tear. And unfortunately, I think a lot of doctors immediately jump to, oh, you have a labral tear, you have to have surgery on that. That is not the case. You can live with a labral tear. So the more important thing that you're looking at is, okay, my MRI says I have a labral tear, but how is it actually impacting me on a day-to-day basis? Because if it's not impacting me that much, do I really need to jump into surgery right now? it's up to you, right? Like that's the decision that you have to make. I always, again, being a physical therapist, being somebody that's pretty conservative on things, if it's not impacting your day-to-day function that much, I'm probably erring on the side of caution and not gonna direct you to the path of surgery. And I think that you should exhaust all your conservative options first. Again, there's some other factors that we'll talk about that play into this, but if we're just looking at impact on day-to-day life, if it's not impacting you that much, going into a surgery where yes, maybe you're going to fix the structure of it, but now you've got to recover from surgery. Like it's not an easy recovery. So I think it's really important to like weigh the pros and cons there. Also the circumstances of your life, right? Like, are you a mom who is with a baby and having surgery, even if maybe it is impacting your function a lot, but you have young kids or a baby that you're having to care for and run around after, and what's it going to look like right now to try to rehab from a surgery? As opposed to, is it impacting you so much that you can't raise your kids? So weighing that, another example would be if you are an athlete or a dancer, what's your season? What point of the season are you in? Are you about to go into competition season? And, is it something that you can wait to get through it? Or is it something that you feel like you have to correct before you're really able to dance again? Because if you can't dance comfortably and it's just continuously flaring things up, like what's the end of that season going to look like for you? So all of these things have to be weighed, they have to be taken into consideration, and everybody's situation is so unique to them that this is something you want to talk through with somebody. Having a physical therapist or a surgeon who is really open to having these discussions and listening to your concerns, I think is really important because your situation is unique to you. But without a doubt, that is something that's really important to take into account, is how much impact is it having on your day-to-day life. So the second decision-making point that I want to bring up in regards to should you have labral tear surgery or not is your willingness to commit to the process. Now, this can be the process of surgery, or what I really mean is willingness to commit to the conservative care. And everybody falls somewhere different in this, right? Like, I tend to see the majority of people that I see are people who are committing to, I want to manage this conservatively. I don't want to have surgery. And as long as you are willing to commit, and again, we have to pay attention to the other things as well, making sure everything else is in a good place. But if you're willing to commit to that process and go the conservative route, then it's worth trying. It's worth doing. It is not easy. It is not a quick fix. It takes time. So you have to be patient with the process. You have to be willing to make adjustments and modifications as we go. You might have to be willing to make a few sacrifices on how active you're being. Doesn't mean you're not going to be active, but maybe you're not running the marathon in the next month. So there's just things that you have to consider of like what types of sacrifices you might have to make, but knowing that those sacrifices are temporary so that you can come out stronger on the other side. Surgery, I always want to make sure that people understand surgery is never going to be a magic fix. I think a lot of times we think it's going to be a magic fix, and we'll talk about this in one of the other points, but we want it to be this magic fix, and it isn't most of the time. And so if you are willing to commit to the rehab ahead of time, what I usually tell people is, even if on the backside of this, like surgery does end up being the end point, and you do actually end up having to do something surgical, at least you've taken the time to learn all of these things that you would have to learn on the back end of surgery anyways. So you might as well invest the time now to learn these things so that if you can put off the need for surgery or prevent the need for surgery, perfect, job well done. But if you do have to have surgery, also job well done, because now you've learned all the things you'd have to learn on the backside of surgery anyways. So you just have to look at, where do you want to make that commitment, right? Do you want to commit to the surgical process and then the rehab process now? Or do you want to commit to managing this conservatively? And if you're willing to manage it conservatively, I would strongly urge you to really think about what that entails and make sure that that's going to be something that you're willing to do. If you do it though, I promise you're probably going to be really successful at it, because the ones that I see that truly commit to it are the ones that are pretty successful at least delaying the need for surgery for a while. So that's the second point. The third one, so should you have labral tear surgery or not? Well, the question is, have you tried to exhaust all conservative measures first? Are we jumping to surgery as the first option, or have you tried a laundry list of things up to this point? Maybe it's injections, maybe it is physical therapy, maybe it is chiropractic, like whatever that is. What have you tried up to this point? How has it impacted how your hip is feeling, what your symptoms are? The caveat to this, and the thing that I would make sure that you are paying the most attention to, is have you tried good quality care, whatever that is? So physical therapy, for instance, is not all physical therapists are created equal. There are people who are really good at treating this, and there are people that are not so good at treating this. And when I get somebody that comes in, one of the first questions that I'll ask them in that call is, what have you tried for this? If they say physical therapy, okay, what did you do in physical therapy? And a lot of the time, the types of answers that I'm getting are, they gave me some clamshells. I did some bridges. I did some banded sidewalks, side steps. I did some squats. Is this sounding familiar at all? And then I ask if it helped, and they're like, temporarily, but like, no, not really, nothing lasting. I'm still in pain. I'm still having the same problems I had. Or sometimes I feel worse than when I started. My next question is, did anybody ever show you how to do those movements? And I will tell you that 99% of the time, the answer is no. So what we get out of this is that most of the time when you go to physical therapy, you're thrown this laundry list of exercises, random exercises that are not connected to each other in any way. You have not been shown the strategy behind why you're even doing this exercise, what it is benefiting you, how it's going to help your hip. How do you move in a way that it takes the load off the joint instead of makes it worse? Because a lot of those exercises actually will make your hip impingement worse. And so how are you moving while you do them? And if you can't honestly answer that, like, yes, somebody has taught me those things, then I would say that you haven't actually exhausted all of your options. Good conservative care will address all of those things. And so I would urge you to do that type of care before you go in for surgery. Because again, just like I said in the point before this, even if you go through that process and surgery ends up having to be your outcome, good job, because you just did all the stuff you're going to have to do on the back end of surgery anyways. Only now you're going into surgery in a better place, hopefully with a hip that's a bit more calmed down and maybe a little bit more stabilized and maybe knows how to move in a better pattern. So you might as well do the work now. But it's really important that you've actually learned those things, because again, if you haven't, I would argue that you haven't actually exhausted all of your options. All right, so point number 4 to consider is, what is your end goal? What is the outcome by having surgery that you're hoping to achieve? And again, this looks very different for every person that's listening to this episode. It could be that you just want to live a normal life and be a mom and be able to chase after your kids and not think about it. It might be that you are a professional dancer and you want to be able to perform again and you're on a timeline. So, and then there's obviously everything in between. Your end goal and result of what you want to be able to do in life, I think, can help determine, is surgery something you should or should not consider right now? Because for a lot of people, if they're not looking to get back to really high level activity, they don't really want to jump and run, they're not a professional athlete, they just kind of want to like go about living life, maybe do some normal exercise stuff at the gym, keep up with your kids, whatever, you may not have to have surgery for that, right? And I would argue it even the other way, where even if you are getting back to higher level things, like it doesn't automatically mean that you would need to have surgery either, because you can do all those things without surgery. But looking at, you know, what is my goal and what's my timeline for getting to that goal, that might influence your decision one way or another. I see things like this all the time where like I have a runner who's like, I signed myself up for a race already, and like I have this deadline and like that's my goal. Maybe I have a dancer. I actually have somebody right now who is a senior in high school, and she wanted to be able to dance her senior season, and the recommendation was to have surgery at the beginning of the school year, and to be able to really have a successful senior year of senior season, having surgery in October wasn't necessarily the best option for her. So she opted, hey, like, let's manage conservatively. Let's just get through my senior year. And then at the end of it, I'm not dancing in college anymore. I'll have the surgery then. And the exact scenario played out that I have told you a few times already. We started through this process. She no longer has any pain. She is dancing 100%, doing all the things that she thought she couldn't do. And she has completely opted to not have surgery anymore. So she put in the work on the front end because she had this goal and this timeline and kind of had already thought that through, but it ended up that she ended up not even needing the surgery because she committed to the conservative care. So these are all things that we want to consider. So number 4 is your end goal, the outcome that you're trying to get, and the timeline that you might be working on. And the 5th thing when you're trying to decide if you should have surgery for your labral tear or not is what your expectations are around having that surgery. And what I mean by this is, are you under the impression that having the surgery will magically fix all of the problems? Because if you are thinking that and you were told that, I would strongly urge you to reconsider that thought. Most of the time, the surgery, well, it will fix the structure, right? It's going to fix where, they're going to shave down where the labral tear is. They might shave down the bone. So from a structural standpoint, yes, we are correcting some things there. However, there is almost always a functional and movement component to impingement and labral tears. The surgery does not address those things at all. And if you're wanting to hear more about this, listen back to my episode from last week where we talked about why you're still in pain after surgery, because we cover all of this. But if nobody has really laid that expectation for you that hey, this problem could come back if you don't do something proactively, even after the surgery, to make sure that it doesn't. We have to correct why did this stuff happen in the first place? And surgery is not going to address that. It's only going to address the structure. So if you are under this illusion that I'm going to have this, it's going to fix the structure, I'm going to come out on the other side, I'm not going to have any pain anymore, I'm here to tell you that is probably not going to be the situation. Has it happened? Yes. I'm sure there are people out there that are like, oh, that's crap. Of course I had it and I feel better. But I would also look at, well, how long were they without pain for? Was it forever, or was it for a year, or did that pain come back further down the line? I think it's really important to make sure that you understand you have to put work in no matter what. Surgery does not replace the need for you to do good quality conservative care. You just are either going to do it before or you're going to have to do it after. Again, my stance is do it before, because the worst thing that's going to happen is you learn how to calm down your symptoms, you learn how to build really good movement patterns, then you have the surgery, and now on the backside of surgery, you're automatically in a better place and your recovery is going to go so much smoother because you're not now trying to learn all of these things while you're also recovering from surgery. You already know, how do I diaphragmatic breathe to release some of the tension that I'm feeling in my glutes? How do I flex my hip in a way that doesn't stress the joint too much? You've already learned all of this. So having those expectations laid out ahead of time, knowing that that is the situation, I think is really, really a crucial factor when you're trying to decide if you should have surgery or not. One of the surgeons that I work with here in town, I absolutely love working with him. And he flat out tells his clients, his patients, that hey, I'm going to do this surgery. It's not going to solve your problem unless you do really good physical therapy after. And I appreciate that he tells them that, because I think there's too many surgeons that don't say that part. I get some that don't even refer for physical therapy after, and I would strongly caution against that. It's really important to make sure that you're having good quality care on either side of it, but especially knowing that going in. This is not a magic fix. There's a lot of work that I'm going to have to do. I still have to learn how to calm my symptoms, how to calm my nervous system. I still have to learn how to move with really good movement patterns, because whatever caused that surgery to happen in the first place, if you don't correct it, again, we correct structurally, but we don't correct the movement piece, there's a really high likelihood it is going to come back further down the line. And again, this is often why so many people have the surgery and still end up in pain, and then they find me. So Again, none of these things, we basically went through 5 decision points, and these are the things I actually talk through with my clients in real time. Keep in mind, the decision isn't based off of one of these things. It is an interplay of all of these things. There are reasons to have it, there are reasons to not have it, there are reasons to delay it, and everything in between. So you have to what I want to do is spark your curiosity and make sure that you're asking yourself the right questions, because if you don't have somebody that you can consult with that you trust to see, like, should I do this surgery? Shouldn't I do this surgery? At the end of the day, you are really the only person that can answer that question based on your situation. But hopefully this gives you some ideas of what you really should be thinking through and things to consider when you're trying to decide if this is going to be the right next move for you. Again, not anti-surgery. However, what I generally tell most of my clients is if it's not impacting you, immensely on a day-to-day level, if you are willing to put in a little bit of work, if you still are able to do a majority of the movements, but maybe there's just still some pain there, the expectations surrounding surgery, I'm probably going to nudge you towards, let's try conservative care for at least a couple weeks, months to see where things are at. Because again, the worst thing that's going to happen is you still have to have surgery, and now you're just in a better place going into that surgery. I recognize that's not going to be the situation for everybody, but again, I do want you to seriously consider these things because I just don't think there's enough education out there about this. I don't think physical therapists are talking through this stuff with their clients. I don't think doctors are talking through these things. So hopefully this episode gave you some things that you can actually think about and consider. Again, I am going to drop a free resource. I put all this together in just a printable resource for you guys. I'll drop it in the show notes so you can grab it there and just have that on hand as a quick reference if you need it. Hopefully this was helpful for you. As always, if you have any questions about this or you ever want to talk through your specific situation, drop me a comment below. You're more than welcome to apply for a discovery call if it's something you feel like you want to talk through with me. But drop your questions below, your comments below. I love connecting with you guys, and I hope to see you back here next week on Unchoreographed. Have a good one.